the audience coming in from the waiting room. Thank you everyone for joining us today. We're just gonna give it a minute or two for people to connect and come online before we begin the conversation. So please go ahead and hold tight and we'll get started momentarily. Thank you everyone for joining us this morning or this evening if you're calling in from Asia. We're going to go ahead and just give people a couple minutes to connect and get online for today's call, and then I'll kick things off momentarily. All right, good morning and good evening, everyone. It looks like our flood of attendees has slowly decreased. So it looks like most of those who are in the waiting room are already on the call now. So I'm very delighted to welcome all of you to the Stimson Center for today's discussion on vaccine diplomacy in Southeast Asia. My name is Courtney Weatherby. I'm the research analyst with the Southeast Asia program at the Stimson Center, and I'm extremely delighted to welcome our diverse and distinguished set of panelists today. I'm going to turn things over to today's session moderator, Bill Weiss, who's the chair of the Southeast Asia Forum, which is hosting this event. But before I do, I just want to briefly give a logistical note to say that we're going to be taking questions from the audience at the end of the call. So please, if you have questions or comments at any point throughout today's discussion, drop them into the Q&A function through the Zoom platform, and I will be moderating those at the end of the session. So without further ado, Bill, I'm happy to hand things over to you and look forward to today's discussion.
Great. Well, thank you very much, Courtney. As Courtney said, my name is Bill Wise. I chair the Southeast Asia Forum at Stimson. A brief word on the forum itself. Our mission is to promote, facilitate, and expand the study of Southeast Asia at colleges, universities, research institutions, and so forth. But our scope is really broader. We also exist to encourage governments and NGOs, the private sector, to focus on Southeast Asia, and in particular, U.S. relations with the region and its states. This is our first Southeast Asia Forum event in 2021, and our first virtual Wednesday seminar of the spring semester. We'll host several more webinars over the time of the semester, and I urge you to check the Stimson Center website for the dates and times of future events. We're very grateful to Henry Howard, a member of our advisory council, and two anonymous donors for providing the seed money that has allowed the Southeast Asia Forum to begin in these difficult times. So today, our discussion focuses on a very timely and consequential issue for Southeast Asia, vaccine diplomacy. Dr. Peter J. Hotez, who may have coined the term in a 2014 paper on the subject, defined vaccine diplomacy simply as the branch of global health diplomacy that relies on the use of delivery of vaccines to promote foreign policy goals. Dr. Hotez, he's the dean of the National School of Tropical Medicine and professor of pediatrics and molecular virology and microbiology at the Baylor College of Medicine, emphasized the role of vaccine diplomacy as a humanitarian intervention tool to mediate cessation of hostilities between adversarial states. But vaccine diplomacy is also an instrument of soft power employed by governments that seek to influence other governments or groups within other nations. And that is the context of our discussion today. Obviously, the impact of the COVID-19 pandemic in Southeast Asia varies by country. The respected Singapore-based Institute of Southeast Asia Studies, or ICES, 2021 survey on the state of Southeast Asia found the threat to or from COVID-19 pandemic to be the #1 challenge cited by respondents in its recent poll. Anxiety over the pandemic was highest in Laos, Myanmar, and Indonesia, probably due to those countries' weaker health systems, and lowest in Singapore, Thailand, and Brunei, presumably because the opposite situation exists, more effective public health infrastructures and hospital resources. The respondents to the IC's survey, these were academics, government officials, and business persons, or in other words, Southeast Asia elites, cited China and Japan as providing the most assistance during the pandemic. India trailed China and Japan at the time of the November 2020 to early January 2021 survey, but has become more recently active in some Southeast Asia states. Notably, only Vietnam chose the US as the most important provider of assistance. And we'll be looking at this as part of a broader discussion of US policy toward Southeast Asia in April. So today we focus on vaccine diplomacy in Southeast Asia as practiced by other Asian governments. Some questions immediately come to mind. How extensive is the pandemic now in the region? Who needs help and who's asked for it? How have other Asian governments, especially China and India, responded to those expressed needs of their bordering states? What are the humanitarian components and the political goals of responding states? How can we measure success in either aspect of vaccine diplomacy? Well, to discuss this subject, we have a panel of real experts today, and I'm going to introduce them alphabetically. Ambassador Robert Blake is Senior Director at McLarty Associates, an international consultancy in Washington, and former U.S. Ambassador to Indonesia. Professor Meli Caballero Anthony is head of the Center for Non-Traditional Security Studies at the S. Rajaratnam School of International Studies at Nanyang Technological University in Singapore. Professor Yanzhong Wang is Senior Fellow for Global Health at the Council on Foreign Relations in New York and Professor and Director of Global Health Studies at Seton Hall University's School of Diplomacy and International Relations. Ms. Akriti Vasudeva is Research Analyst at the Stimson Center's South Asia Program and Editor-in-Large of South Asian Voices. I encourage our audience to read the full biographies of these experts and the references that we've provided. You will, I no doubt, be impressed. So our format today will be quite direct. We'll begin with a discussion with the panel, putting some of the important issues on the table right away. Then we'll open up to questions from our webinar participants. Courtney Weatherby, our Southeast Asia Forum coordinator and research analyst at the Stimson Southeast Asia program, will help with the Q&A. So this is intended to be a real seminar, a real discussion, and we encourage our panelists to intervene at any time with their comments and observations. Please note also that this webinar is being recorded and the video will be available on the Southeast Asia Forum web pages at the Stimson Center website. So, Professor Anthony, let's begin with the state of the pandemic in Southeast Asia. Where are COVID-19 cases on the rise? How well is the disease being managed by regional governments? What is the demand for vaccines? And what's the supply situation? I think you are muted, Meli, and so you need to unmute yourself.
My apologies.
There you go.
I was going to say thank you very much for the kind invitation. I'm really delighted to join everyone in this panel and to talk about a very important topic. What's the state of the pandemic in the region, and where are we? I think 1 year since the COVID-19 has affected all of us. One could observe that the Southeast Asian region, I think compared with the rest of the world, have fared comparatively better in managing the spread of the pandemic and keeping fatalities low. When you look at the total cumulative cases, it hovers around 2% of the total global cases, and the same with the fatality rate. But progress in stopping the pandemic remains uneven across the region, with some countries doing much better, like Singapore, Vietnam, Thailand, and to some extent Malaysia, and the others, particularly Indonesia and the Philippines, which have considerably larger population, are still, I would say, are still seriously challenged in trying to really bring down the cases, although compared to the past few months, you can actually see some improvements. And there are a number of reasons to explain why some countries are doing better than others. But on the whole, I think, given the fact that this is not the first time that the Southeast Asian region has experienced a crisis of this nature, the lessons from the past has certainly helped a lot in managing the crises. The pandemic preparedness mechanisms have been put in place when the COVID-19 pandemic broke out. So you had countries basically prepared to deal with it. But it was not expected that the pandemic was going to last this long. And this is where, towards the middle of the year, you could see that some of the progress more or less were affected, because in some cases, like in the Philippines, which started had a good start, had to deal with the return of a lot of foreign workers coming into the country, and this is something that was not anticipated by the government. So, at one point, the number of cases really shot up, but after a while, it started to be managed. The kind of measures, I think, that most governments have taken when it comes to, managing the pandemic, starting with, of course, the most drastic lockdown, or as we call here in Singapore, circuit breaker, to stop the stem of the infection, actually really helped. Some countries still have some kind of modified restrictions, movement restrictions, so to speak. These public health measure, when it comes to testing and tracing and isolation and quarantine, also help quite a lot. Even down to the very basic behavior of masking. I mean, and that has really been compulsory in in all countries in the region. That has really helped. But challenges remain, and for as long as not all countries are able to get access. When we talk about vaccines, this is really now one of the major approaches to hopefully end this pandemic. What should note, however, that the vaccine is just, as they say, one of the instruments in stopping the pandemic. So in countries where the vaccines, the strategy is not as well defined as other countries, then most of the measures will have to depend on the more traditional public health measures of masking, social distancing, isolation, and quarantine. As far as the vaccine policies or strategies are concerned, again, it is uneven. You have Singapore that is basically leading the pack. Vaccinations have already started for some countries, Indonesia, for example, Singapore, even Laos, and to some extent Myanmar. Others are hoping that the vaccination will start at least in the second quarter of this year. But one of the major concerns as far as vaccinations are concerned is really the access to more remote areas and the supply, whether they're able to get the supply as expected, given the kind of challenges now that we see around the world as far as production of vaccines are concerned. So, if everything goes on track, we really hope to see a more dramatic improvement, hopefully by the third or the fourth quarter of 2021.
Thank you, Melly. Ambassador Blake, focuses on the Indonesia case. Indonesia is, of course, Southeast Asia's most populous country, and as an archipelagic nation, occupies a wide geographic space across the southern part of the region. Health services are a challenge to the government in normal times. How has the government managed in its response to the pandemic?
Thank you, Bill. And first of all, thank you very much for the opportunity to participate on this distinguished panel. It's, I think, a really timely conversation. Let me preface my remarks with a little bit of humility, since America's own record of dealing with the virus has been checkered, to say the least. But with that, let me just dive in and talk a little bit about how they've dealt with the virus and then what the plan is on vaccines. As Melly said, Indonesia has recorded the highest number of COVID-19 cases in Southeast Asia, and a very, very high death toll as well. And that's for a number of reasons. I mean, from the beginning, many Indonesians have been critical of the government for what they saw as its late and slow response. And to begin with, many senior government members played down the risk of the outbreak. In addition, their preparedness was really not as much as it should be. Their testing capacity was very, very low to begin with. As Bill alluded, the hospital system did not have sufficient PPE, and indeed many doctors and healthcare workers became infected. And the hospital capacity as a whole is rather low. World Bank data indicates that Indonesia has 1.2 hospital beds for every 1,000 people, compared to, say, Malaysia and Singapore, which have roughly double that. And as well, the Indonesian government, because they have a very large percentage of workers in the informal economy, they really tried to prioritize the economy over public health, and that led to the continued spread of the disease. I don't want to get too much into the details of their current things, but I think another factor is that a relatively high proportion of Indonesians have pre-existing health conditions of one sort or another, things like cardiac disease and hypertension, diabetes, that have made them more vulnerable to catching and dying from COVID-19. It is important to say that Indonesia is beginning to see improvements. Like many countries, they had a post-New Year spike, but in the last few weeks, they've seen drops in the numbers of new cases and in the positivity rate. So I think that's encouraging. On the vaccination side, they plan to vaccinate approximately 180 million people, which is roughly 2/3 of their population, which is what they calculate they need to achieve so-called herd immunity. They hope to be able to do that in about 15 months. They're planning to procure vaccinations from a number of different sources. They're the largest importers of Chinese vaccines. So the Sinovac vaccine has already been delivered, some doses of that. They'll also be getting it from CanSino Biologics, but also from Western company. AstraZeneca has pledged doses. Novavax, which has not yet been approved by the FDA in the United States, but is expected to receive approval in the next few months, will also be supplying doses. And then, of course, the government has also requested doses from the Gavi Alliance. The government has prioritized, to begin with, in their first phrase, healthcare workers and some public servants. And more than 1 million healthcare workers have already received their first dose, and about 500,000 their second dose. And phase 2 is now beginning today, as a matter of fact, where they're going to be targeting about a little under 40 million people, including public sector workers, the elderly, teachers, workers in the hospitality sector, and even small traders. They amusingly have a pilot project to vaccinate 55,000 small traders in Jakarta's famous Tanah Abang market, which is where Jokowi took Mark Zuckerberg to see Indonesian commerce in action. So, I think they're slowly picking up the pace with vaccine rates, but they're still far below their target of 1 million being vaccinated daily. If I had to kind of summarize the challenges that they face, one is that there's still quite a lot of skepticism in Indonesia about the safety of the vaccines. One respected group reported that only about 65% of the population is willing to receive the vaccine, and the rest were either undecided or didn't want to do it. So President Jokowi signed a presidential order last week making vaccinations compulsory for all eligible recipients. So obviously it reflects their concern that people might be resisting this. The other, I think, big issue that Indonesia will face that will be quite unusual, like the Philippines, is that they have an unusually complicated logistics challenge of delivering the vaccines to people on 6,000 inhabited islands across a distance that is equal to that between Alaska and Florida. And in addition to that, they are thought to have only a fraction of the refrigerated trucks and cold storage and containers that they need. And then Indonesia is, has their usual bottlenecks at ports and traffic and so forth. So this is going to be a big challenge. And I think, therefore, the help of the Chinese and America and others will be very, very important. And I look forward to having a discussion about how we can help on that. Thank you.
Thank you, Bob. Professor Wong, let's turn now to the key question of how external actors are participating in the vaccine supply situation in Southeast Asia. Tell us, if you would, about the Chinese policy regarding the supply and distribution of vaccines that China has developed and manufactured. Where in Southeast Asia has China focused its activities, and what, if any, geopolitical advantage does China expect to gain?
Well, thank you, Bill, and thank you for inviting me to this distinguished panel. I really learned a lot from the presentations of Melly and Ambassador Blake. So, in terms of China's vaccine diplomacy, certainly China didn't say what they want to achieve through the distribution of vaccines in Southeast Asia. They actually were very sort of being irritated when, they were told they were practicing vaccine diplomacy, because, that probably give, this sort of like a negative connotations, contradicting to President Xi Jinping's remarks of making the vaccines a global public good, right? But if you look at the numbers, right, how the vaccines are distributed in the region, and I found that this unlocked some very interesting clues on what they want to achieve in the region, right? So far, 3 Chinese companies, Sinopharm, Sinovac, CanSino, have committed 250 million doses of vaccines to the region, right? And that, compared to, these 400 million doses they have been committed worldwide, actually show that Southeast Asia is indeed a priority of China's vaccine diplomacy, because you talk about 62.5% of those vaccines actually are being shipped, are being committed to Southeast Asia. China has so far shipped at least 46 million ready-made vaccines or their active ingredients around the world, but nearly 40% or 18 million doses actually was shipped to Indonesia, one country, right? And secondly, if you look at also, how the countries receive the Chinese vaccines, like you actually, they have 2 types of countries you can identify, right? One type of country basically receive the Chinese vaccine through donations, right? These countries include Laos, Myanmar, Philippines, Cambodia, and Brunei, right? The Brunei, we don't know how, what's the amount of vaccines, that be donated to the country. I'm sure it's probably very negligible. But the Laos, 300,000 doses, Myanmar, 300,000 doses, Philippines, 1 million, Cambodia, 1 million, right? But if you compare this amount to the actual population level, right, the actual what is needed to achieve herd immunity, the aid is only like sprinkles, right, in those countries, right? And secondly, this second type of countries is that those who received vaccines from China through this commercial supplies, signed contracts, right, buying the Chinese vaccines. But these countries, I'm talking about the countries that have already purchased the Chinese vaccines or in this process of negotiating with the Chinese, for purchasing their vaccines. But these countries include Vietnam, Indonesia, Thailand, Malaysia, and the Philippines and Singapore, right? And so far, 2 countries, Indonesia and Philippines, already have signed contracts, right, to purchase Chinese vaccines. Indonesia, has said they will purchase 125.5 million doses from China, and Philippines said they will purchase 25 million doses. And incidentally, as Melly has just suggested, these are the 2 countries that are hit particularly hard by the pandemic, right? That indeed provide clues on the objectives of China's vaccine diplomacy in the region. First, I think they want to project, its soft power. They want to show goodwill. And hopefully they want to fill the void left by the United States, but in terms of leadership, or in terms of the US retreat from the global leadership, created that opportunities for China to fill the void. And secondly, they want to showcase China's technological prowess. They want to expand the market share of their vaccines, and they want to actually promote the use of Chinese vaccines in the region. At a time, when its vaccine is the safety, efficacy being questioned. That Ambassador Blake just mentioned that Indonesia, 65% actually said they will not get vaccination. And certainly, but that is the Chinese company is going to reap the profits, from those purchasing, from those deals. We don't know because they haven't, because those deals are signed confidentially, right? So we cannot compare notes. But from to my knowledge, Indonesia actually purchased vaccines at the price of $20 per dose. That. I think is relatively high, compared what we know in terms of the price. They sold to other countries, which they sold to other countries like Ukraine. It's, I think, $17.5. Brazil is $10. Turkey it's $13. So 125.5 million doses. And $20 per dose, that is about $2.5 billion. So, that is certainly, I think, for Sinovac, it's going to raking a lot of money from the purchase, from the sale. And thirdly, I think they want to cement the political and economic ties to the countries in the region and to facilitate the implementation of the Belt and Road Initiative, and hopefully also to soften the stand of countries in this, territorial disputes with China. I'm talking about countries like Malaysia, Philippines, Vietnam, and Brunei. But thus far, it doesn't seem that they have been making any significant progress on that front. We can talk about that during the Q&A. So with that, I'm going to stop there.
Well, thank you very much, Professor Wong. Next to my Stimson colleague, Kriti, looking at India, what's the view from New Delhi on supplying medicines, supplying vaccines to other countries, and especially to Southeast Asia states? Where has India been focusing its activity, and what, if you can discern them, what are India's geopolitical goals in this endeavor?
First of all, thank you so much for the invitation to speak on this panel, Professor Weiss. Glad to be in such august company. Now, talking about India, so India's COVID-19 diplomacy did not start with vaccines. It started with providing medicines and other assistance to countries all over the world. I mean, India provided COVID-19 medicines to 150 countries, many of them as grants. And then starting just 4 days after its own domestic vaccination rollout, India began supplying vaccines both on a grant basis as well as commercially to countries all over the world. And currently, India is manufacturing and supplying the Indian version of the Oxford AstraZeneca vaccine, which is called Covishield, and an indigenously developed vaccine called Covaxin. But other vaccines are under advanced trials. So as of February 12th, India has donated 6.47 million doses to mainly countries in South Asia and provided about 16.5 million doses commercially to countries all over the world. And as I said, significantly, these are made up of countries in South Asia, the Middle East, and key states in the Indian Ocean region. And India is also committed to providing 100 million vaccines to the Global Alliance for Vaccines and Immunizations, to the COVAX facility, which is for low and middle income countries. Coming to Southeast Asia, where has India focused its activity? So India donated 1.5 million doses to Myanmar. These doses arrived in at the end of January, before the coup, and they were used to start inoculations of healthcare and frontline workers at the end of Jan. I believe there's also been some commercial supply subsequently. There was some discussion in December between the two countries about India holding clinical trials of its vaccines in Myanmar, but I'm not sure where that is now after the current situation. But India's also supplied 100,000 doses to Cambodia through the Serum Institute of India, but it's unclear if it is a grant or on a commercial basis. But the request came directly from Cambodia's Prime Minister, and India agreed to provide the vaccines on an urgent basis, even though we know that Cambodia is also is expected to receive doses from China as well. In addition, India is also in talks to supply vaccines to Mongolia, and I think the logistics of this are being worked out, particularly with respect to transport and infrastructure. And then India's also signed up to manufacture Novavax vaccine, which will be called Covax, and Philippines has signed up for about 30 million doses of this in the second half of 2021. So far, these are the only Southeast Asian countries India has donated or supplied vaccines to. And part of this, I think, maybe because Southeast Asia's vaccine procurement has been a bit slow, as Professor Melly was also mentioning. But it could also be because countries like Indonesia and Thailand are manufacturing vaccines locally themselves. But in terms of why India is doing this and in what are its political goals in this endeavor, first, I think India has the capacity to provide vaccines to the world because it is the largest manufacturer of vaccines, accounting for about 60% of the global supply. And second, because in recent years, India has made humanitarian assistance, disaster relief, and in general, responding to crises in its neighborhood as part of its regional goals. And I think vaccine diplomacy is part of that. So you'll often hear Prime Minister Narendra Modi talk about the idea of security and growth for all in the region, or SAGAR. And he calls this as using India's capabilities for the benefit of those in the common maritime region of the Indian Ocean. And Prime Minister Modi also told the UN General Assembly in September that India's vaccine production and delivery capacity is going to be used for what he said, to help all humanity in fighting this crisis. So India is, this is an indication of India's efforts to position itself as, a purveyor of public goods in the region, to gain goodwill, to present itself as a responsible regional and global stakeholder ready to undertake a burden of responsibilities, and particularly as an aspirational leading power. So obviously, this also has ties to India's geopolitical competition with China in the region, both in its near neighborhood in South Asia, but also the extended neighborhood, such as in Southeast Asia and the Indian Ocean region. And this is indicated by, if you look at the countries India has chosen to provide free vaccines to, such as Cambodia, Myanmar, Maldives, and Mauritius, these are countries where either China has a stronghold or where India is trying to make up for an increase in Chinese influence. This indicates that India's vaccine diplomacy is about positioning itself as a regional leader, competing with China. And I think this is especially relevant because, in my point of view, India has found it difficult to compete with China in offering huge investments in terms of economic development or infrastructure projects in the region because of its resource constraints. But since it does have the manufacturing advantage and capacity with regard to vaccines, this can be a good way to, as I said, generate goodwill and improve relations in the region.
Thank you. Thank you very much, Akriti. That's actually a very useful way to present the donor side. And Ambassador Blake, I'd like to turn to you again and ask you to describe how the Indonesian government may have leveraged its vaccine requirements with these external suppliers. How, as the recipient country, how has the vaccine diplomacy practiced by others impacted the country? Has it changed minds or altered views?
Well, I would say, first of all, they're trying to line up as many vaccines from as many suppliers as they can. As I said, they're sourcing from 2 Chinese companies, but also from several Western companies as well. The Indians are not, to my knowledge, involved so far. But as I indicated, there is some skepticism about particularly the Chinese vaccines. And, that's not to be totally unexpected. China does not have the same vaccine track record of India or of Western countries. They're a relatively recent entrant to the game, whereas India has been providing pharmaceuticals and vaccines for years and years and years. And of course, so have Western companies. And of course, I think China has not really been as transparent as the Western companies or India about publishing its vaccine data in respected peer-reviewed journals of various kinds so that people can really understand how effective it will be. So, but that said, Indonesia didn't really have the luxury to sort of sit back and say, well, we're not going to take the Chinese vaccine. They need it, and they need to get on with vaccinating their people as quickly as possible. And I think the other factor for the Indonesians that was very, very important is that the Chinese were willing to license Indonesian state-owned enterprises to produce the vaccine. So the Indonesian state-owned enterprise called PT Bio Farma, for example, has been licensed by Sinovac to produce, I think, 25 million doses per month, which is significant, both because of the additional doses that will be provided, but also because Indonesia, like many countries, is trying to build up its local manufacturing capacity. So they see this as a golden opportunity to do that and to show that their state-owned enterprises are really capable of delivering. And as long as they can get the raw materials to do this, I think they are in a good position to do this. So the fact that the Chinese are willing to share and license their vaccines for local production is, I think, another thing in their favor that so far the Western companies have not been willing to do.
Well, okay, Professor Wong, back to you then. The available COVID-19 vaccines obviously differ in the number of doses required, storage temperatures, and so forth. The health infrastructures in Southeast Asia also differ markedly. From your perspective, and perhaps looking at imagining how Beijing looks at this question, how well equipped are Southeast Asia states to manage large-scale immunization campaigns? Are there potential problems of immunization failure here, or will this move as smoothly as perhaps Indonesia hopes?
Well, that is a great question. That's certainly why I think the Chinese-made vaccines, they have certain advantages. One of the advantages is that they don't have this very demanding requirements, for ultra low temperature. Well, that is particularly helpful, as Ambassador Blake just indicated, for those, the cold chain, the shipment, storage, right, of the vaccines, in those countries that faces tremendous logistical challenges by the distribution and administration of their vaccines. So China's vaccines did have a sort of competitive edge, and as far as this is concerned. But as also as Ambassador just suggested, there's a lack of transparency issue. So far, they haven't published detailed data on the phase 3 clinical trials. In a way, they are less forthcoming than Russia, in terms of publishing, disclosing the data. And there's also based on what we already know, what is the Sinovac vaccine, for example, has a relatively low efficacy rate. I think that has implications for the vaccination rate, the vaccination rate needed to achieve herd immunity, because if you have an efficacy rate basically lower than 80%, pretty much you need to have the entire population get vaccinated in order to achieve herd immunity. But so in Indonesia, as we said, they are only planning to have 2/3 of the population vaccinated, right, to achieve herd immunity. But that seems to be a goal not reachable if you use the vaccines, below with efficacy rate below 80%.
Kriti, India has the second highest COVID-19 caseload in the world, I believe, though the number of cases is actually dropping now, as it is in many other places. But India has also donated a significant number of vaccines to neighboring countries, as you mentioned, where New Delhi is competing with Beijing for influence, as you suggested. But I wondered two things. First, will there be domestic repercussions as a result of the donation of vaccines to foreign countries when not all of India has been vaccinated yet? And second, and only tangentially related to the first question, is how will India, do you think, judge the success or failure of its vaccine diplomacy in Southeast Asia? Is it on a humanitarian scale? Is it on a political scale, or some combination of the two that you can see?
Thank you, Professor Wise. On the first question about whether there have been or likely to be domestic repercussions of India donating or commercially supplying vaccines, that has not been the case so far, simply because India's domestic vaccination rollout is ongoing. India is expected to vaccinate about 300 million people by July, and the Ministry of External Affairs and the Prime Minister himself has said that any donations or commercial supplies that are happening are after considering the domestic requirements. It's only in keeping with those requirements that these these supplies or donations are being made. And I think it's also a question of capacity. So India's only donating doses which it's not going to be able to use anyway right now based on the capacity of vaccination that it does have. So those concerns have not arisen. In fact, I think this is actually seen as a moment of pride by many Indians that India is able, stepping up sort of its, soft power. It is, the pharmacy to the world, which very often, Indian leaders have been saying. So this has actually played pretty well domestically, I would say. On the question of how will India judge its success of its vaccine diplomacy in Southeast Asia, I think it's still early in terms of India's supply of vaccines to Southeast Asia. Like I said, it's only about 4 countries that have either requested or got donations. So I think it will first depend on the extent to which India is able to provide support in these countries. But I think India will sort of look at it as, another way of engaging these countries, because India does have its Act East policy, which has, political, economic goals that are going on simultaneously to this. There are lots of conversations with countries like Vietnam or other countries, even with respect to security cooperation, maritime security, blue economy. So those are ongoing in addition to the vaccine diplomacies. I would say that it depends on, first of all, the extent of help that India is able to provide based on what the requirements of these countries are, and also, how maybe other countries are responding to these challenges as well.
Bill, can I just jump in for 1 second
Please.
on India?
Yes.
Bill, I think one of the interesting dynamics at play here for our audience is that India it has the second highest number of cases in the world after the United States, and yet they're still pursuing this vaccine diplomacy. So I think it kind of shows the importance they attach to this vaccine diplomacy, and it's a little bit of a risk because, of course, many Indians still need this vaccine themselves, and so whereas China, for example, has managed to get the COVID situation under control, so they're in a much better domestic position to pursue this vaccine diplomacy. And the United States is quite clearly said they're not going to be providing vaccines to begin with because we want to vaccinate our own population. So India is in a quite an interesting, unique position here.
Yes.
Bill, may I just follow up quickly with the ambassador's comments? I think this is sort of counterintuitive, but when you look at India, right, the Delhi, for example, now has like more than 50% infection rate. That means also like 50% of people already sort of achieved immunity, right, through these infections. So that might also release more like a room of space for India to practice the vaccine diplomacy, because the domestic demand for vaccines may not be that high. But then you look at China, right, they have fewer cases. That is true. But in the meantime, it also means a large percentage of the population actually are not exposed to the virus. So that actually make it the challenge for China to actually, because they have to also achieve the herd immunity by immunizing a larger percentage of the population. So this need to balance the domestic needs and international demand become even more glaring.
Quite true.
Yeah. Professor Anthony, I wanted to finish my set of questions with you with what I think for Southeast Asia is really the key question, and that is, what do you anticipate the effects of vaccine diplomacy, perhaps mid to long term, will be? And by that I mean post-pandemic or post-height of the pandemic. How do you anticipate the effects of vaccine diplomacy competition in Southeast Asia will work out for Southeast Asians? And two things that I wondered about there. First is it possible that the end result of vaccine diplomacy competition in the region will be an abundance of supply and thus a more rapid reduction in COVID-19 caseloads than we might otherwise have anticipated? I know that is a very difficult and speculative question, but I think from Southeast Asia's point of view, it's one worth asking. And the second part of the question is, from Southeast Asian perspective, will the donor states benefit in terms of broader and deeper influence, do you think? Thank
you. I have a different take on this talk about diplomacy. Because if you look at the vaccine strategy adopted by Southeast Asian countries, and countries that you think are, would have the choices would in a way indicate the preferences, that's not actually. I won't put too much into it, because if you look at the strategy, the aim really is to get as many supplies, as many different vaccines that is available. So starting with, of course, the more expensive Pfizer and Moderna, and of course Sinovac, and even Russia's Sputnik. We don't forget there's also that vaccine that's being developed. So the aim is to get as many vaccines as possible and to get access to it, and not be and it's good that China makes it available. It donates. There are arrangements, and the fact that China is able, like India, is allowing some pharmaceutical companies, not just in Indonesia, but even in Malaysia, the Pharmaniaga and even Thailand, to produce this vaccine, because the aim of the region is to also be able to have the capacity to produce, so that there can be a manufacturing hub and a distribution hub of vaccines, right? So it's not a question of, it's good that China is able to provide this, because, as you know, while China was talking about, vaccine diplomacy and giving these donations, some countries are also very worried because of the, on the one hand, they have this, but on the other hand, they're increasing their aggressiveness in the South China Sea, and people and the countries in the region are not blind to that effect, right? So in the case of India, it's good because, the fact that India having the capacity to manufacture vaccine, and is also, I think, they have this arrangement through AstraZeneca in Thailand to be able to produce that, then to me, it allows the region to have the capacity to address the issue of access to vaccine, and address the issue of being able to provide, especially since it's so uneven and there will be gaps in supply, gaps in distribution and gaps in supply. So that's on the one hand. So building that capacity is very, very important, and it's being talked about in the region among countries that, while we have our own respective policies, strategy, there has to be a conscious effort to ensure that you're able to ramp up the capacity of the region to actually address this. Do you hope that these vaccines will eventually really have a significant impact on reduction of cases? Well, yes, but at the same time, other countries, like if you look at Vietnam, they haven't started the vaccination, and yet with a population of close to 100, a little over, the cases have been very, very low. And you ask yourself, right, why have they, how have they managed to do it? And it's really it's a combination of things. One is that there's really very targeted efforts in ensuring that the country is prepared to deal with this after their experience with SARS. They have been able to ramp up the hospital capacity, surge capacity, and secondly, it's really a very strict enforcement of public health measures. There's no such thing as debating whether you need to wear a mask or you don't need to wear a mask. And they were the first to actually close borders. Close the borders to China, and of course, in Singapore and the rest. So it's more a question of having that capacity, right? Domestic and regional capacity to deal with this, rather than to rely on vaccine diplomacy. Because at the end of the day, right, that they can only do so much, because, given the kind of herd immunity that you need to have, to be able to finally get rid of the vaccine, you cannot deny, you cannot rely mainly on donations from other countries, and this is why I said it's very uneven, because some countries have been very good in their strategy, and there are other countries, because of the nature of governance, I won't say poor governance, but maybe slow, and they're not able to have a very decisive policy on which vaccines and how they're going to start that. But having said that, one should not also ignore the fact that having gone through several pandemics, from SARS to H1N1, etc., there is some capacity in the region to deal with that, in spite of the very serious challenges of public health infrastructure. And when you're talking about the perception, the attitude, the lack of confidence by some people about the vaccine, and I mean, it's very natural, because in cases of the Philippines, there was this thing about the dengue vaccine. It was a disaster. On the other hand, in the cases of Indonesia, really that the fear of these vaccines, the same, because it's an unknown thing. They don't know whether it's safe. And then you have in Malaysia. But what the government has done, and I think that's very important, the public messaging that has gone. In areas where you don't have television, it's hard to reach. What the Indonesian government has done is actually using religious leaders to help convince people that it's good for them to actually get vaccinated, that there's nothing sacrilegious about using it, that it's it's not something that's forbidden by Islam, etc. So there are a number of strategies, right, that complements, are in fact even stronger, hopefully, than reliance on vaccines to deal with this issue. So on the other hand, it's good to put, it's it's interesting to talk about the influence of China and the influence of India on the management of the pandemic. At the end of the day, it's really the capacity of individual countries to ramp up that capacity to deal and to stop the stem of the infection.
Point.
So, Wise, if I could just add 2 quick points.
Yes, please do.
On the question of capacity that Professor Melli was just talking about, I think just wanted to add 2 thoughts on India. One is, in addition to the vaccines that India has provided, in the case of especially the countries that it has donated to, India has actually also conducted trainings for the operational and administrative aspects of, immunization managers and data managers. So it's on both at the national and provincial levels in these countries to ensure that it's not just sort of handing over the vaccines, but also ensuring that they are, correctly distributed and the immunization is done correctly. So I think that is something that can be an asset in Southeast Asia. And the second point is, sort of broader point is that India has a large history and experience with immunization. So beyond the vaccines themselves, there are a lot of avenues for sharing best practices, how to arrange logistics, because the population of India is so large as well. So I think there are those conversations that can happen, especially in the context of Southeast Asia. And there are mechanisms that exist for this to happen.
Good. Well, thank you. We will move the webinar end time to 10:45 because we have a significant queue of questions that we want to get to. And to manage the Q&A session, I'd like to turn to Courtney Weatherby for her moderation assistance. Thanks, Courtney.
Yes, thank you. So as Bill said, we have quite a few questions. So I'm going to probably end up combining or tagging on points to a couple of them. But we're going to kick off with a question from Lin Yang from the Voice of America, who asks about U.S. efforts and policy to provide vaccines and assistance to Southeast Asia. So Lin Yang notes that there's strong interest from countries around the region in securing vaccines from the West, in addition to the Chinese vaccines that have already been made available. Are we seeing any effort from the United States to perform vaccine diplomacy in the Southeast Asian region? And tagging on to that, we had a few other questions about non-vaccine assistance. So one commentator noted that the United States has a long track record of logistical assistance, for instance, with typhoon relief operations. So are there opportunities for the United States to provide other types of assistance in addition to vaccines?
Is that a question for me, Courtney?
Courtney, you're muted.
The question was not directed specifically.
Well, let me as a former U.S. diplomat, let me take the first shot at that. First of all, I think American diplomacy can take a number of forms. Of course, we can help with vaccines once we've vaccinated our own population, or at least a critical mass of it. But don't forget also that countries are going to need technical assistance of all kinds. And countries like Indonesia are going to need logistical. And I think America can provide all of those with great skill. I mean, we bring several very big assets to the table. We have, of course, substantial experience helping to mobilize global responses to previous pandemics, the Ebola and SARS and so forth. We have an incredible network of our AID and CDC and other health experts in embassies around the world, each with their own deep network of contacts. We have a long history of health assistance through our PEPFAR and other programs. And of course, our own NGOs like the Gates Foundation, the Clinton Foundations have been very, very active and have their own networks in places like Indonesia. And then I saw that one question was about the military. The US military has unparalleled logistical and lift capability. So, and they for years have been exercising with their military counterparts all over the Indo-Pacific region, and specifically in what they call humanitarian assistance and disaster relief. So they could, I think, bring enormous assistance to bear with these logistical challenges. And then last but not least, our companies themselves, in addition to the vaccines, there are companies like FedEx and UPS who are very good at delivering temperature controlled, containers and packaging and even vehicles. So there's an enormous capacity, I think, for America. And the Biden administration so far hasn't really said anything about this, but Samantha Power, who is the nominee to lead USAID, wrote a very influential article in Foreign Affairs in January saying that she herself is a big advocate for this kind of health diplomacy. So I think you're going to see, once she takes office, a very energetic effort to help these countries in some of the ways that I described.
Maybe I can weigh on here.
Yes.
I completely agree with Ambassador Blake on what America can offer. It's really a question of when America can offer. Yes, if you look at the history of American assistance in public health diplomacy, you can see that if you recall in 2003 when they had SARS and they had H5N1 and H1N1 with the bird flu and all that. It was the U.S. did a lot in actually providing for the self-protective gear, the public PPE, for example. There was that supply. And technical training, very important, especially when it comes to diagnostics, ensuring that the laboratories in the region the skills are up to high standards, especially now, that there's a lot of, there's a need really to ramp up the capacity of laboratories especially when it comes to testing. And, with all the developments in rapid testing that I could see in the US, that's really that's an area that needs to, that has a lot of promise, because, it's not just a vaccination, it's really being able to test and to trace. I mean, that's why in some countries they were able to effectively contain, because the testing capacity was very good. In the case of Singapore, the aim initially in the first 3 months was to step up the testing to 40,000 a day, and now it's more than that, really. So that really helped in the contact tracing. So it's important for the region, I think, to see America involved in this process, because as Ambassador Blake has mentioned, there's a long history too of this humanitarian assistance and disaster relief. You have all of these exercises that's taking place. So that is just a natural extension of this humanitarian activity that the US has done. But that's what the US can do. But you should also be mindful that there are other countries in the region that plays the same role that the US has been doing, right? China is one. You also have Australia, you have Japan, and you have South Korea. So the US now has to, when it sees itself vis-a-vis the other players in the region, it's good for it to reflect on where it stands vis-a-vis the other dialogue partners in the region, because surely now there are other players, and of course there's China that can offer maybe the same, maybe not the same, but a significant contribution that the U.S. used to have, right? When we talk about advances in vaccines, I mean, yes, there were initial concerns and doubts about whether Chinese vaccines are actually as good as the vaccines developed in America because of the long history. But there's also this recognition that there's so much progress already that China has achieved when it comes to technology. I mean, if you have China as the number one, is number one in artificial intelligence and all that, then logical thinking means maybe it's also the same advancement in vaccines. And I don't know, maybe Yansong can say about this. I think the Chinese, at least as far as Sinovac is concerned, I think they have published their results even in medical journals, maybe not as transparent or as widespread as others. So, there are developments, there are capacities by other dialogue partners that are being visible and readily available for countries in the region. So the monopoly that the US had before is no longer there. Yeah.
Courtney?
Yes, so we're going to change pace and switch to looking a little bit more at what India is doing in the region. So we have a couple questions for Akriti and others on the panel. Maria Laskamp from Dutch Daily de Volkskrant has a question about how the images of Chinese vaccines delivered to all corners of the world resonated with Indian foreign policy experts. And how has this impacted India's vaccine diplomacy? Was that a motivating factor? And in addition, we had a couple other questions about sort of how vaccine diplomacy from India to Southeast Asia fits with its neighborhood first policy, and the extent to which India's involvement is welcomed by Southeast Asian states who want to diversify their vaccine sources.
Thank you, Courtney, for those questions. I'll keep it quick because I know we're close to time. With regard to how Chinese vaccine diplomacy is perceived in India, I haven't seen too much on that. I will say, though, that obviously, 2020 has been a very difficult year for the India-China relationship. We know that a border standoff, was going on between the two countries. Right now, it's in the process of disengagement. So in general, perceptions of China were pretty negative throughout 2020. And I think, I'm not sure if it's related to the vaccine, but I think, India's vaccine diplomacy commitments were actually announced before, some of the rollout probably happened from China. I think it was announced in September. So I'm not sure if there's too much of a link there, but in general, obviously there is the sense that, China and India are rising at the same time. They are both vying for, regional leadership and competition in the region. And so that, is probably an underlying rationale definitely for India's vaccine diplomacy in Southeast Asia. Whether it's connected to India's neighborhood goals, I think, it is, because the external affairs ministers very directly linked India's, vaccine campaign called Vaccine Friendship to its neighborhood first goals. And I think I also saw another question in the chat about how does India decide which countries to provide, donations to or supplies to. I think it's been a combination of wanting to prioritize low-income countries and countries that are, in need of vaccines, particularly in its neighborhood. That's why you've seen a lot of India's donations go to its smaller neighboring countries. But, I think it's safe to say that obviously the consideration is also geopolitical. And because India sees this as a way to, present itself as an alternative to China, as, a more transparent, a more democratic, country trying to increase its goodwill and trying to, again, in the context of, the Indo-Pacific strategy and just a rules-based order as well, this does play into how India wants its image to be seen in the region, and it's definitely part of its neighborhood goals.
Thank you. So I'm going to ask what I think may be our final question for the evening, as it's getting late in Asia and we're over time a little bit, but we had a few questions about sort of regional cooperation in response to the pandemic. So we had one question from Him Rotha from the Cambodian Institute for Cooperation and Peace, which was for both Ambassador Blake and Professor Kabir Anthony, asking how ASEAN is impacted by and responding to vaccine diplomacy as an institution. And we also had one comment about sort of the general challenges that the World Health Organization has faced in handling the pandemic, and has been criticized for its handling of the pandemic. So a question about whether that will indicate an inflection point where countries in ASEAN and around Asia may focus on regional cooperation pathways rather than international organizations to address similar challenges in the future.
Melly, do you want to answer the ASEAN question? I haven't really seen very much from ASEAN on this, from the Secretariat.
On which, on the vaccine?
Right.
Yeah, you're right. I think when it comes to having a regional policy on vaccine, there has been, you don't hear anything visible or that's coming out. What has been discussed so far is coming with the most is having a common medical and travel protocol, And maybe in that respect, if we could sort of indirectly see, because there is discussion about really the differences and the gaps in access and supplies. And so what could happen is, and that's already among the health officials, is really a discussion on identifying where the gaps are. But as far as, having a regional policy on vaccines, like, for example, having a pool of resources to buy vaccines. I mean, there was the discussion before when it comes to being able to have this a fund, a common fund to buy, to develop and to buy vaccines, but I haven't seen that yet, but that's in the discussion. But there are other forms of cooperation that's taking place. Really, it's more the kind of sharing of information. And as far as vaccine is concerned, it is really trying to generate information so that you can have standardization of policies when it comes to approval of vaccines, because that's what you need. There's some countries are very fast and some countries are slow in deciding. So that is where regional cooperation can take place, where you actually then have this an agreement on a sharing of standards. That's one. The other is a policy on on inclusivity. One has to remember that there are countries in the region that host migrant workers from their neighbors. Right. So when it comes to vaccine policy, a big question to ask is whether you are actually these migrant workers in your own country are actually have access to vaccines. And it's good to note that Singapore has said that everybody who lives in Singapore can be vaccinated, including migrant workers. I think yesterday you had a very clear message from the Malaysian Prime Minister that all migrant workers will be vaccinated. The logic being that if you keep them safe, then you also keep the citizens in Malaysia safe. I haven't heard from other countries. It would be good to hear that from Thailand, and that is something that is really a good indication of the kind of cooperation that's taking place, right? To ensure that citizens of ASEAN who are residing or are working as migrant labor in other countries are actually get protection. So I think in three areas: in identifying gaps, in sharing information, and I think this policy of inclusivity will be a good indication. Now, does this therefore, does this have an impact on the support for international efforts? No, because at the end of the day, many countries in the region appreciate and recognize the efforts that the WHO has done, particularly when it comes to technical assistance, information, support. And so it has to be both ways, international at the regional level. What the region can do is actually to ensure that some of the agreements and the norms that have been introduced by the WHO, particularly when it comes to, for example, disease report, surveillance and reporting, etc., that is being implemented at the regional level. And this is where the ASEAN story of cooperation among health officials has been quite significant. And I've written about this before. This actually helped, at least in the first 3 months of the outbreak, when there was this exchange of information, not just within ASEAN countries, but within the wider ASEAN +3, where information from China was immediately conveyed to countries in Southeast Asia and allowed them to activate the pandemic preparedness programs that they've had for years. So regional efforts complement international efforts because it allows for filling in many of the gaps that the WHO may not be able to do. Yeah.
Thank you, Nellie. And we unfortunately have reached precisely our last minute of time that's been allocated us. So I'm going to have to cut the questions and answers right here. But I want to say thanks first to this absolutely outstanding panel of experts. You were excellent, and we really appreciate your time and especially your expertise. Nellie and Bob and Akriti and Yanchong, thank you for a really fascinating discussion. Thanks also to our audience for joining us. and for raising such interesting questions. I'm sorry we didn't get to all of them, but having done Zooms for a year now, I think the answer to that is we actually never do, but we always try. If you are a student at a university or a faculty member at a university and have additional questions for the panel, please send them to me and I'll forward them as appropriate. And everyone, please do check our new web pages at the Stimson Center website for news and events of the Southeast Asia Forum. Until next time, then, thanks so much for being with us. Good day in the US and good night in Asia.
Good night.
Yep.